They're trying to set you. Oh. All right, let's get started. Okay. Let me say good afternoon to everyone, and let me also acknowledge Mayor Pro Tem Dave Martin, who's with me, and Councilmember Peck, and we are in District A, which is Councilmember Peck City Council District. And then pleased to have Congresswoman Sheila Jackson Lee. She's here before she boards her plane and returns to D.C. So thank you, Congresswoman, for being present. And then Sayed from UMMC is here as Sayed. Is also present. They are commanding this particular site. So I want to thank UMMC for their collaboration with the city. They've done so much on the testing side, and now they're collaborating with us on the vaccine distribution. Director Stephen Williams is present, as well as Dr. Purse is also here. So today, the City of Houston Health Department is opening its first drive-thru vaccination clinic in partnership with United Memorial Medical Center. Let me just say that this will be a daily site that will be operating Monday through Saturday from 8:30 till 5:30. And they'll be doing on average about 1,000 a day. And again, let me also say it will be by appointment only. So please don't just drive up. It will be appointment only, but this will be a stand-up site. And then on average about 1,000. Depending on the supply that comes into the city, that's given to the city health department, we can ramp up based on available supply. UMMC has been a leader in providing COVID-19 testing and caring for patients with the virus, and I want to thank them for working with the City of Houston to open the drive-thru vaccination site, making it more convenient for people with mobility issues and providing the vaccine services in this area of town. The health department received an additional 9,000 doses of the vaccine last Friday. In addition to scheduling this particular location, the department will transfer another 800 doses to other providers and fulfill exiting appointments at Bayou City Event Center, is Health Center, and Multi-Service Center. So in addition to Del Mar, which will be Monday through Saturday, 8:30 to 5:30. The Bayou Center is operating. The Sunnyside, the La Nueva Casa de Amigos site, as well as Sharpstown. And then as the supply ramps up, then we'll be able to expand to additional sites throughout the city. As we receive more vaccines, we will expand partnerships with pharmacies and federally qualified health clinics to ensure the vaccine is available in the most vulnerable communities and deploy more mobile strike teams as needed. I will say that we will be out in the A-Leaf Westwood area on Saturday as well, reaching out in that particular part of town. I will work to vaccinate as many people as possible as based on available supply. And I know there is a lot of anxiety in the community because people are worried that they cannot get an appointment schedule. Again, as frustrating as it may be, I want to encourage people to be as patient as possible. We know that the demand is higher than the supply, and that there's a high demand for this vaccine, which is good. But everyone is working on every level, from the feds all the way down, to increase that supply. That is why also in part my Office for People with Disabilities is working closely with the Houston Health Department's Aging and Disability Resource Center to ensure that people with disabilities and seniors have access to vaccines as quickly as possible. People with disabilities and seniors can call 832-393-5500, 832-393-5500 to be put on a COVID-19 vaccine waiting list. It is very important that you share the number with people in your network because we know the elderly and those with disabilities have a tougher time accessing the appointment portal once it is open. You can also call the Area Agency on Aging, to be put on an appointment wait list if you are also over the age of 65 years of age. And that number is 832-393-4301. That is the Area Agency on Aging, 832-393-4301. We are limited by vaccine availability, but we are doing everything we can to use the resources that we do have and to make that available and to do it in an equitable fashion. As you wait, please continue to do your part to stop the virus from spreading. That means you should continue to wear a mask, practice social distancing, wash your hands frequently, and get tested. Today, unfortunately, the Houston Health Department is reporting the largest number that it has ever reported in a single day. And so today we're reporting 3,039 cases of COVID-19, bringing the total case count for the city of Houston to 148,515. And let me quickly add, that is due to some corrections that the systems have made over the last 3 days. As you know, like yesterday, the report was 267. And so they have corrected those numbers over the last 3 days, and that explains why this number is so high. So today we are reporting 3,039 new cases of COVID-19. We are also reporting 11 new deaths as a result of COVID-19. So 11 more persons in our city have died. And we are now currently operating with a positivity rate in the city of 17%. Now, let me just say, even though the number is high, the 3,039 that I'm reporting today, when you look at the more granular data, it does reflect that things are improving slightly. So, for example, the reproduction rate, that number is at this morning, as of this morning, 0.82. Which means that the virus is not spreading as much. It's under 1. The number of people, for example, in our hospitals, now in this 9-county area, which includes City of Houston, Harris County, that number has gone down from where it was. Instead of being 2,200, the number's a little over 2,000. So that number is starting to go down. The number of people in our ICUs, that number is starting to go down. So many of these other indicators suggest that things are getting slightly better. I don't want to overstate that, because you really have to look at like a two weeks period, a 2 week span of time, 14 days. But it does show that things are getting slightly better. But again, that depends on our behavior and how we work collectively to get on top of this virus. But the virus is very much still in the community. I want us to be mindful of that. Testing is still very important. Testing, wearing these masks, the social distancing, all of that's important. And then at the same time, we will do our very best to get these vaccines out as quickly as possible. Let me yield, and let me bring on Dr. Purse today to speak to what's happening as it relates to this virus, and then he'll be followed by Director Stephen Williams. Dr. Purse.
Thank you, Mayor. Congressman, good to see you again. So, the Mayor has given the numbers. I want to remind everyone, as the Mayor pointed out, that the data is showing some improvement, which is obviously very good and welcome. I don't want anyone to think that that's because the vaccine is solved it. Very, very few people in the community compared to the entire population have been vaccinated, and so we need to continue to wear our masks and social distance. And in fact, it is most likely that this change in direction of the data is because people are changing their behavior. Perhaps during the holidays, people dropped their guard and we took some risky behaviors that we otherwise might not have, and now that the holidays are past, people are getting a little bit more diligent. So those things, wearing your mask, social distancing, they make a huge difference. And so I want to echo the Mayor's comment that that's what we should do. The other thing to let folks know is there's been a lot of confusion and a lot of anxiety about the vaccine and getting second doses. And so With the Pfizer vaccine, the second dose is due on 21 days after the first, and with the Moderna vaccine, the second dose is due 28 days after the first. For both of those vaccines, they said in the very beginning, they gave a little bit of a leeway that if you could get vaccinated up to 4 days early from that date, and that would be fine. But that's not the question people are asking, because there is some angst about you being able to get in and get your second dose. And so the manufacturers in the beginning has said that you could also get vaccinated as late as 4 days after that date. That guidance has changed slightly from the CDC. The CDC is now putting out some guidance that may be confusing to people, and so I want to make sure I'm very clear about this. It is still ideal for you to get your second dose just as close to the 21-day or 28-day scheduled second dosing that, depending whether you get the Pfizer or the Moderna vaccine. You should still strive to get your second dose as close to that date as possible. However, the CDC has now said that they believe that up to as many as 42 days after the initial dose may be a window during which people shouldn't have to worry too much, that there'd be expectation that the vaccine will work just fine. And so if you're not able to get vaccinated exactly on 28 days or 29 days after the Moderna, but you should get it on day 30, day 31, day 32, something like that, I wouldn't lose any sleep over that, okay? But I also don't want people thinking, oh, I don't need to worry about getting a second dose. You absolutely do need to focus on getting your second dose. We know from the data that the first dose primes your immune system, but it's the second dose that really drives home the stimulus to your immune system to make you immune. So again, don't let this new guidance confuse anyone. Try to get it on the date that it was assigned, but if you're a couple of days late, don't lose any sleep over that.
Yeah, thanks.
Thank you, David. I want to first start by thanking UMMC, Saeed, Dooney, for their willingness to open up this drive-through site. We at the health department had actually piloted a drive-through site, but what we recognize is that we could probably reach more people if we can partner with other folks to expand our footprint within the city of Houston and Harris County. I'm also going to talk a little bit about some things that we really need to be responsive to. The mayor, and reiterate, the mayor mentioned that at our clinics, we don't want people to just show up. We recognize that as people go on our registration site when it's opened up, that people might get a QR confirmation code. But oftentimes they leave the site without getting a confirmed time and date. And we're saying that if you don't have that date, and if you don't have that time, then actually you're not registered. So please don't show up. We're working diligently to set appointments and to really get vaccines in the arms of as many people as possible. We recognize that due to the scarcity of vaccine, that there's a lot of frustration amongst people who want to get vaccine. We will do the best that we can, but we ask people to be patient with us and know that as time goes on, more vaccine will become available. And on the second dose, and I really appreciate David actually explaining that there is a larger window for getting that second dose than most people understand it. It is up to 42 days. As a matter of fact, with Pfizer vaccine, their test does expand it actually up to 43 days. If you are vaccinated by the Houston Health Department, we're going to reach out to you within the appropriate time frame to get that second shot. I want you to continue to check your emails, your voicemails, and your text messages from us, because we're going to reach out to us. I've even had people to contact me when they in fact have voicemail messages to schedule their appointment. So please be on notice that we will contact you. If your contact information has changed after you've received the first dose, we're asking you to call our call center to make us aware of that so that we can adjust appropriately. This week, we plan to give a total of more in excess of 10,000 doses through our clinics and through our partners. But as the mayor said, we're also going into the A-Leaf area and partner with Hope Clinic and Ibicina Clinic to ensure that more vaccines are available on Saturday and Sunday. We'll continue to expand our footprint as vaccines become available. We're working not only with FQHCs, some pharmacies, but been on the call with Harris Health, really trying to utilize their system, especially within the city of Houston and certain neighborhoods, to ensure that vaccine is available around the corner from a lot of our residents.
Thank you, Dr. Williams. What I want to emphasize is that the more supplies we get, the more we're able to do, even at this particular site, because the capacity, the infrastructure is available to do exponentially more. Everything is predicated on the supply. The same thing, we can expand the number of sites within the area based on the supply. The other thing I really want to hit home, because with respect to that second dose, please, we're asking people, number one, the health department will call you. But if you haven't received a call, for example, please don't start reaching out to us unless you're within that, let's say, like a 48-hour window before that 28th day period is about to hit, or the 21 period if you're with Pfizer. But the health department's goal is to reach out to you. Please do not call, for example, if you're 10 days out, okay, before that second dose is available. Please don't do the calling. That will only make things more difficult for everyone. And so bear in mind, we're still having to give people their first shot, and there's a huge demand for that. And then, of course, scheduling for the second shot. So on the second shot, we will call you. But if you haven't heard anything from us within, let's say, a 48-hour period, then reach out to us. Now let me call on Congresswoman Sheila Jackson Lee.
Thank you, Mayor. May I applaud you for being a pilot or an example for the nation in how to distribute massively the doses that you are getting. So let me thank you and thank your partners, UMMC, the City Health Department with Mr. Williams and Dr. Pertz for coming together around ensuring the widespread distribution of what you have. The federal government is committed to ignoring any rumors that have been presented that they would be stretching out the first dosage and not committed to getting the second dose. So I want to say to the mayor that it is our commitment that you will have your second dose to be able to provide to those who have courageously and willingly registered to secure the vaccine in order to stop the community spread, because we recognize that the mutations are coming. Some are already here. Some have been determined to be contagious but not deadly, and some are now speculated to be both contagious and more deadly. So we want to make sure that everyone knows to follow the protocols that the city has put in place, and that there will be a second dose as distributed by the federal government. Everyone knows that we are now reviewing a $1.9 trillion package that includes the additional funding for more staffing, additional funding for more testing and tracing, and vaccines. And that we are about to run through our gamut, run through our tracking system with the FDA for an emergency waiver, Johnson & Johnson. So we are on point for responding to the needs. And one of the representations that I will make to the COVID-19 task force organized by President Biden is that cities that can stand up sites can receive directly, and counties, their vaccines, that they do have the infrastructure to receive it. And we would like to advocate for some cities across the nation, like Los Angeles and Houston and New York, which is suffering, that they would receive their vaccinations directly. We also want to take note of the fact that there is a commitment to help local governments stand up schools, close to $160 billion, I believe, that will be focused on testing everyone in the schools and teachers and otherwise to work to make sure that we stand up the schools, which I believe is extremely important to do. So I would just try to reinforce one point. Someone asked me, well, didn't you get vaccinated? I did it publicly because as a member of Congress, it was part of our responsibility as the continuity of government. But why are you wearing a mask? whether you're vaccinated or not, please continue to wear that mask, socially distance, and washing your hands. If you're not vaccinated, again, the city has multiple testing sites. And so I say get tested while you wait to get vaccinated. I was trying to get it rhyming, but get tested while you're waiting to get vaccinated, because you can also be tested for free as you are getting vaccinated for free. So if you're not vaccinated, you're still susceptible to being anti-symptomatic and contagious. That means you have no symptoms, but you are spreading it to somebody else. Please continue to get tested. And Mayor, I'll continue to stand up these testing sites. I want to acknowledge our council member for this area, Councilmember Pack, for her leadership, and our Mayor Pro Tem is right there, and my neighbor and Councilmember Cisneros. I think I've gotten all of them. Well, I think I've gotten all of them. And I thank you, Mayor, for having a team that's ready to do everything they can. And the UMCC team, I want to again thank you. Thank you, Dooney Hebram, as well. I call her doctor, but she'll soon be that. But I do want to make sure. Let me finish by saying we are now looking at the $1.9 trillion budget. Mayor, I want you to know that your money for local government is absolutely there. And we will absolutely provide local government with that funding that we have been working on for very long. We are possibly having to do this through budget reconciliation, which is an expedited process. And for those listening, we will also have the enhanced $1,400, and we'll be looking closely at those workers making under $40,000, which have been suffering. So please don't hesitate on your second dose. Don't be fearful. Follow the protocols of the city, and also continue to get tested. And we are assured that you will get the doses for your second dose. And we are also trying to assure a readily organized distribution of the vaccines, that you will know a schedule by week or bi-weekly when your vaccines will be coming in. So thank you so very much, and we can all do this together.
Thank you, Congresswoman, and we are absolutely waiting on the local assistance and absolutely need it. So thank you so very much for your efforts. Again, Councilmember Cisneros, I apologize. I didn't acknowledge you. So thank you so very, very much. And then, of course, Chief Pena. Chief Pena, anything to add to this report? Okay. And we'll take any questions or comments anyone may have.
Thanks, Mayor.
Yeah.
I know there was a lot of discussion about Minute Maid last week. Is this site and the other sites you're talking about in Sunnyside at the service centers, is that an indication the city's not prioritizing mega sites at Minute Maid as much anymore, and is committed to sort of diversifying or going to these smaller sites?
I think what we're trying to, the infrastructure is in place. To the extent we need to go back to Minute Maid, we will. But again, it's all based on the supply. Give me an example. If we got 9,000 doses that came in on Friday for the entire week. In Minute Maid, for example, we end up doing over 6,400. Well, if we kept that site up and did it at that pace, we would be like other cities like New York, where you're running out and you're just stopping. And then we had all these other appointments that were already in the system for Monday, Tuesday, Wednesday, Thursday, and Friday. And then we would be forced to tell people, sorry, we will have to reschedule. So until the supply exponentially increased, we decided to kind of stand down from that for the time being. And at this site, for example, Del Mar, every day, Monday through Saturday, there are no long lines. People don't have to wait 2 and 3, 4 hours. There are no major hiccups. People come in, they're not here very long, they get their shots, they wait 15 minutes, some cases 30, and they're out and they're gone. And we can do about 1,000 a day, and then we don't have to cancel any appointments next week. And we're still providing additional doses to other providers. And just like on Saturday, we'll be in the A-Leaf Westwood area. So just based on the limited supply, we just think that's a smoother way to go. And now if the supply should go from, let's say, 9,000 to 18,000, or 20 or more, and then we can ramp up. We know those venues, and then we can accommodate a lot more people. But it's all based on the limited supply. We just felt it just didn't. It was creating more inconvenience to set up that bigger site and to have a lot of people go through, and then you have those kind of extended wait times and what have you. So this is just a better way to go.
Understood. There's been a lot of discussion about the sign-up process as
And
well.
hold on, did I get that right? All right.
There's been a lot of discussion as well about the sign-up process, Mayor. Some older folks who aren't on Twitter or don't know how to get alerts from Houston Alert to figure out when to sign up. The county today launched a wait list to sort of take the pressure off trying to be online at all times for whenever appointments come up. Is the city evaluating doing something similar to that? I know you mentioned the phone numbers that you've launched. Any comments on that strategy?
It's just a different way of doing it. Working through the area agency on aging, they've got a waiting list. There were two numbers that I gave. Working with the mayor's office, people with disabilities. So it's two ways. Yeah, the flip side of that, you can establish a wait list, and you can have 100,000 people on your wait list. And the question what people will be asking is, when will we get it? And so you can put people on a wait list, and let's say that the time could be sometimes in February and March, but people don't want to wait that long. So it just varies. When you have a very limited supply, I don't think there's any sort of system that's really going to alleviate the frustration. I do think that working through organizations like the Area Agency on Aging, that they work with them on a daily basis. They have a good sense of who's out there. That we can work efficiently through that system. But Steve, you want to add to that?
Yeah, essentially, the county formalized what we've been doing for weeks. We wanted to make sure, we know that, there are some frustrations in trying to sign on online, and so therefore our call center is working. The two numbers that the mayor gave are other avenues for folks to actually get in. I think working with the Area Agency on Aging and our Aging and Disability Resource Center, that those are quite appropriate for the 1B population that we're serving now.
Just to clarify, so are you saying you can call those two numbers and get on a wait list to get the city vaccine?
Essentially what happens is when people call in there, they wait. They're put on a list, and we try to work them in. Because we recognize that, everybody is not tech savvy, and so we have to provide other avenues for folks to get in. But remember, the Area Agency on Aging is geared to serve those seniors. And that's pretty much people 65 and above.
But I just want to make sure I understand correctly. So is it when new appointments are open and the portal's launched, they can call this number instead of logging online, or is it someone could call today and say
when the portal is open, basically you go to the portal to sign up. We will give you notification that the portal is open, but at the same time you have those other avenues in order to make appointments.
It's 2 shots.
No, I get that. I guess what I'm asking is, those phone numbers, can you call today and say, I want to get the vaccine, and you'll be put on the list for the next time the appointments are open? Or is it just that when the appointments are open, you can also call that instead of going online to register?
Judy, you want to come and address that?
So if you're 65 or older, you can call AAA and they will put you on a waiting list. They have appointments that they're making at the health centers, so they're the only ones that are making those appointments. When we open up the portal, it's for the general public.
Okay, so it's separate.
Yes.
And when you say AAA, is that
Area Agency on Aging.
okay? Thank you.
Initially, and let me just say, when we started, for example, we opened up the portal, the wait list for the entire month of January. So that's one way of doing it. Sometimes people will open it and they can go however many people signed up. But I think the experience that I've seen in talking with other mayors, when they have opened it up all the way like that, people still want to know, are we getting the vaccine next week? Is it in February? Or is it in March? And then that really doesn't alleviate the frustration because people are wanting it now. I think the best way to address that, quite frankly, is this two process. If you open up the portal, it's opened up to everyone. But then there are specific groups that have worked repeatedly with the Area Agency on Aging. That's a clientele that they have, and people are quite familiar with them. And for some people, they'll rather just work through that organization because they've been doing it for years and years and years. Just trying to find the most comfortable way for them, convenient way.
Just a quick point of clarification,
Sure.
Mayor. So I know that registration was booked for the month of January. For folks showing up here today, are these folks who are already registered, or is that if you register today, for instance, you can come in and do so?
And I'll let Judy, you want to come back? I do know, for example, that we had booked everyone, let's say early on, a couple of weeks ago, for the entire month of January. When we got more supplies, the staff got on the line and brought them in sooner based on the supplies. So they had booked a reservation for January. As the supplies came in, we brought them forward, and then it allowed us to open up those slots. I think that's the same way that we're operating now.
Another question, when you look at dashboards around Southeast Texas, Harris County too, when you look at the residents who are being vaccinated,
Right.
the percentages of those who qualify or identify rather as Latino or African American are significantly lower than those who identify as white. Why is that the case from your perspective, and does this fix that?
Well, one of the reasons, when you open up the portals, it's open to everyone. And then bear in mind, the way the system is designed, even by the state, is that the 9,000, for example, that we receive are not Houston specific. When we open that portal, it is available to everyone in this region. And so you have people who are utilizing that portal that are from Houston, Harris County, the surrounding counties as well, and they are driving in to take advantage of the vaccine. Now, I know. Okay, you want to answer? Yeah.
When you look at that data, one thing that you should understand is that I think only 30% of the people that are actually filling out that information. So it's really incomplete information. One of the reasons that we wanted to be deliberate about certain providers in certain regions is to really address that equity and access issue. For example, Harris Health, we know the demographics of their population. When I look at Ibicina, who we are looking at supporting next Saturday and Sunday, I looked at the demographics, and primarily those are people of color that frequent those clinics. That's probably the best available data that we have to ensure that we're dealing with access related to equity.
So if it's first come, first serve, and not
But let me answer that, because
Okay.
I don't want us to miss. Because a week or so ago, there was a round table at Methodist, I think, that the governor had on vaccine distribution. And one of the points that I emphasize is that when you're having a round table on vaccine distribution, there should be equity at the round table, because that's critically important. I think one of the stations also ran a story in terms of when the state is giving these vaccines to these various providers, that where those vaccines dosages are being allocated will also have a great deal of, will determine who's getting what. So for example, Houston is just one of those providers. There are many other providers where the state is giving those vaccines. So you also have to look at where those vaccines are being given, and that it too will have an impact on whether or not there is diversity in distribution or equity in distribution.
So with that, where they're being allocated right now, is that at all equitable?
Well, right now, we can certainly do better in terms of making sure that it's equitable. It is important, for example, when you were talking about supply, to be able to establish distribution centers in many, for example, of your low-income communities and communities of color. But but when the supply is limited, it's very difficult to establish those different locations in these different communities. That's just like on testing. On testing, We were able to provide testing sites throughout the city of Houston. I want to commend Congresswoman Sheila Jackson-Lee for all of the testing sites that she set up. But we wanted to make sure that there was that we were getting into these communities. That's why we established the Health Equity Response Task Force to make sure that these communities were not being left out. The same thing applies to vaccine distribution. That is very, very important. For example, to provide additional doses to like the City of Houston Health Department, because quite frankly, we are the community arm. We are the ones that also have a greater responsibility, or take on that responsibility, let me put it that way, of making sure that these vaccines are distributed throughout the City of Houston and that there is equity in distribution. But that doesn't start with the City of Houston. It starts with the allocation that's coming from, let's say, from the state, where those allocations are being sent, who's around the table when these decisions are being made. And so I understand what you're saying, but those would be excellent questions to pose to the state of Texas.
Can I add something, Mayor?
Certainly.
I'd like to be a little bit more blunt. The stakeholders in this are not only the city and county, it is the federal government, and we inherited a very unassembled, a very haphazard, or a completely absent distribution protocol. What we're looking to do now is to respond to cities. When you think of New York, it is New York State, but you're thinking of the city of New York that had to shut down its testing. When you think of the devastation in Los Angeles or California, you're focused on Los Angeles. So what we're intending to do, and what has already started, is that the mayor will have, and hopefully, a partner in FEMA. President Biden sent FEMA to West Virginia when they were short on staff and the ability to distribute vaccines. So the first thing that we are going to change is a regimen on distribution of vaccines, obviously enhanced production. And then we're going to have a partnership using FEMA and the city health departments and others to make sure that we focus in on these underserved communities. And the last point I want to make is it's my understanding that a community in Dallas County, in Dallas, attempted to serve hard-hit communities, Hispanic and African American, and their vaccinations were on hold for them not to do that. And I think what we have to say is that we're all in this together, and by distributing to hard-hit communities, you're not in any way trying to diminish the vast numbers who want to receive it. That would not be what we're doing. But in the federal government, we are going to be focused on hard-hit areas so that we don't have stories of a family, Hispanic and African American, where they buried their mother and the son, these are a grown son, and they funeralized the father and another son on Saturday, and the entire family is gone. These are what we're seeing in these hard-hit communities and low-income communities. So we're going to try and take up the slack to help these cities by giving them the amount that they need, but more importantly, actually having language that says it is acceptable and right to be able to work with vulnerable communities, low-income communities, and minority communities as it relates to vaccinations, as we did with testing. And it works.
Councilman Peck, you raised a good point, why don't you? Because we're in your district.
Thank you, Mayor. To address that question too, District A is majority Hispanic, and so Mayor has brought this location to an area that has been very hard hit with COVID, and at least giving people an opportunity to get it in a place that's very close to them.
Thank you very much, Councilmember Peck. And that is also, let me just really make a hard pitch on the importance of having direct distributions to cities. I cannot stress the importance. And I want all of you, because I want you all to take a, where's Dylan, all you? I want you to take a look at this press conference and the diversity of this round table on vaccine distribution. Okay? Now the same questions you all asked me, Y'all ask those questions to the state. Why does the state get a pass? Okay. Now, I try to be very, very patient. I try to be very, very, very patient. But the same questions that you all are asking me, I don't control the distribution process in terms of the vaccines that come to the city of Houston. The state determines who gets what and how much when. Okay? This is the most diverse city in the United States, the most diverse city in the state of Texas. Now, I don't mind helping to mediate the state on how to have equity in distribution. But I can tell you that over 34,000 people have died from this virus. And a disproportionate number of them have been people of color. That's what I can tell you. And what I can tell you is that we do our very best in this city to make sure no community is left out, that all communities are at the table. That is what I can tell you. But we represent the last mile of the way. We're the last mile. Now, if these vaccines were being given directly to the city of Houston, I could have a much greater say at how we get them out and how quickly we can get them out. But that's not within my total power.
Just one last minor question for you, Mayor. I know you said you're aiming for 1,000 a day here.
Yes.
At those other sites that you guys have at the service centers, are they also aiming to do 1,000 a day, or do you know around how many those are shooting for?
About how many, Judy?
So we have this location at Del Mar. The goal is 1,000 a day, and we want to be able to do up to 3,000 on the weekend, on Saturday. We also have the Bayou Center location, where we're getting up to a capacity, where we intend to get up to a capacity of 1,000 a day. We have 4 health centers who can do, right now they're doing about 84 a day each, but our goal is to get them up to 100 per day.
Thank you.
So the goal is at the end of the week for the whatever the amount that we receive, that's out. Okay, that's the goal. And the more we get, the more we can do. All right. And we're not getting up. All right, so I'm going to exhale for a moment. And council member, Chief Pena, you want to come up? I was gonna do it, but you know, if you do it in Spanish, my tutor didn't show up this week. 8:30 to 5:30. Monday through Saturday. Yeah. 5:30, Monday through Saturday.
Buenas tardes. Mire, para nuestra comunidad de habla hispana, les quiero comunicar unos datos de este centro que está aquí atrás de nosotros. Este centro va a estar abierto de las 8:30 a las 5:30, del lunes a sábado. Y son para citas que ya están puestas o personas que ya tienen citas. Si para las personas con discapacidades y las personas mayores pueden también llamar al 832-393-5500 para ingresar a una lista de espera para la vacuna del COVID-19. Personas que tengan más de 65 años también pueden llamar a la agencia de área para personas mayores para que los ayuden a ingresarse a una lista para espera a estas citas. El número de la agencia de área para personas mayores es el 832-393-4301. Como dice el alcalde Turner, las vacunas que estamos esperando aquí en la ciudad de Houston están siendo administradas en cuanto lleguen. Quieren dar más de 1,000 vacunas al día en este centro y en los otros centros que tienen abiertos el Departamento de Salud también. Y estamos esperando. I already gave him that. Yes, sir. Estamos esperando que nos lleguen más vacunas y en cuanto lleguen más vacunas, más centros y más dosis pueden dar en estos centros. Pero el problema ahorita que estamos teniendo no es necesariamente de capacidad de personas para que demos las vacunas, sino las vacunas apropiadas que tengamos, el número de vacunas que tengamos que recibir. En cuanto a esas vacunas aumenten, el número de vacunas, podemos incrementar el número de personas que les podamos dar estas vacunas. La congresista Sheila Jackson Lee ha prometido que están enfocados en dar vacunas adicionales para todos los centros de las ciudades y en eso estamos esperando. Gracias.
Thank you also very much. Safe travels, Congresswoman Sheila Jackson Lee. Going back, appreciate everything you're doing. Said, is there anything that you want to add as Dooney as it relates to this site?
Mayor Turner, good afternoon, and thank you so much for working with us at UMC. You and Congresswoman Sheila Jackson Lee have been giants in this community in ensuring that we go all out to fight this pandemic since its onset. You have worked with us in testing of the citizens of this great city and now vaccinating everyone. We thank you for partnering with us, for considering the work that we are doing at UMMC. Director Stephen Williams, you and your team have just been phenomenal. I see one of your foot soldiers here, Kaylin Henderson, who has worked tirelessly with us. Richard Jones, Decretia Lembrick, and Shira Abdul, who are not here. To tell you, Mayor, they call me 1 o'clock in the morning, 2 o'clock in the morning. They have just been phenomenal. And we just thank you. We're here to work and ensure that our citizens of this beloved city stay safe and healthy every day. UMMC has tested over 400,000 people, and now we are here with this great giant and pioneer who decided to partner with us in setting up this drive-thru at Del Mar Stadium. So we will do our best, as we always do, in making sure that everything is at the excellent level. So thank you, Mayor Turner, for considering us, and thank you, everybody, all the city council members who are here, and Dr. Peirce, who always calls us for everything. Syed Mohideen, our CEO, he says no to anything. When the mayor calls, when Congresswoman calls, he says, we are ready, let's go, and we work with the city. So thank you for considering us. Thank you.
Thank you again, UMMC. Thank you so very, very much. I'm glad to know that my people are answering the phone at 1 or 2 o'clock in the morning. I don't know why they're not answering my call at 1 or 2 o'clock in the morning, but I want to know I will be calling this morning at 1 or 2 in the morning. So please pick up, okay? All right. Thank you so very, very much. Appreciate everything. Thank you all.